Okay, the YouTube live stream isn't working, but I am recording the meeting to the cloud with Zoom, and we're ready to go.
Okay, we're live on Zoom, Mr. Chairman.
Very good. Welcome to the April 27th, 2020 meeting in the Yarmouth Board of Health. And since this is a virtual meeting, we need to take attendance. Eric, are you there? That I can't hear. So we need to unmute, I guess.
Eric is present.
Great. And Bruce?
Present.
Very good. Mary?
Present.
Charlie?
Present.
Deborah? I don't hear Deborah. Okay. Christine, are you there? I guess not. Okay.
Deborah might be calling in right now. We're trying to check that number.
Okay. Well, either way, we have a quorum for the meeting. Director Murphy, did you want me to wait a moment or not?
Oh, boy.
Just ask Deborah, I believe you're on the screen.
Can you hear me?
Yes,
Deborah, great.
Okay, sorry I'm late.
that's
No,
fine.
you're just fine. We're just taking attendance. Very good.
Oh, okay, great.
So, let's work away at the agenda here.
Thank you. Have a great day. Me too. Stay healthy.
Public comment is the first item here. If anyone has called in, anyone has any questions, would like to address the board, this is their opportunity. If someone is out there, would like to join the virtual meeting here. Anyone? We'll assume
Mr.
they're not.
Chairman, this is Rich Bienvenu. I do have our email address that's published in the agenda, public comment at yarmouth.ma.us. So there's no comments in that email, and I don't see any participants in the waiting room to join.
Should I interpret that there's no public comment at this time?
That's correct.
Okay, if that changes, we can certainly address someone. Okay, second item is the coronavirus update. And Director Murphy, I'm going to let you go with this. There's quite a lot of material to cover, so thank you.
Is Bruce talking?
Yes, I think that would be fine. What I'm going to do is I'm going to call up a couple graphs that we have. And I think as we explain the graphs, then we can have a little wrap up at the end. But I think we put about 4 or 5 graphs together. So let me call them up on the screen. The county one first. I'm going to start with the county health department graph of cases within Barnstable County first.
Bruce?
Yes?
This is Mary Craig. I'm on my iPhone in the car, so I have no visuals here.
All right, I'll explain that when the graph does come up,
Thank you.
which is coming up right now. The county bar graph started about March 14th and goes up to the, looks like the 26th, and it's a bar graph that shows the graph on a steady rise up to the 772 positive cases within Barnstable County. So looking at that, the graph, you can see it started off very slowly in the first 2 weeks of March, but then right around March 30th to April 1st, it really started increasing daily. So I think that shows you a nice visual of the increase of the coronavirus cases within Barnstable County, in that the cases are still on a rise right now. We have not reached a plateau or started to level off or go downhill at this point in time. The graph shows that we're still on the increase. And this chart is based on as of April 26th. The next chart will be the town of Yarmouth chart graph. Let me call and pull that up. Number of cases. Yes, I don't think it's not the weekly one. Yep, this is the confirmed cases for the town of Yarmouth. Again, you can see it starting off with Yarmouth's first case on March 11th. Then we didn't have another case until March 17th, and then March 23rd. Then you could see it going right up from the 27th and going right up. And you can see the increase in confirmed Yarmouth cases up until the 26th, where we have 62 positive cases within the town of Yarmouth. So again, this graph is showing the increase in Yarmouth cases, still on the increase and has not plateaued off and still going up. I can see you on now, Deborah.
Oh, sorry about that.
That's fine. So I think looking at that graph, it's you can see the town still going up and still showing a rise and not leveling off. I think that's what we wanted to see on this particular graph. Okay. What do we have for next graphs? We got I don't think we labeled them all.
Bruce is just going to work with me to find the graphs, and we'll be right back.
This graph that we have right now shows the Barnstable County graph that we had going up to 772 that you can still see is going up. And what we tried to do is put the town of Yarmouth graph on the bottom part of that just shows what the Yarmouth cases, positive cases are. And it's small, so it's hard to take a big looking at the curve when you look at it just on this little graph by itself, but you can see the county graph still going up, and then you can see at the bottom the number of positive cases that have increased in Yarmouth up to 62 has been consistent and hasn't leveled off looking at this graph. And then we have a line graph that also shows it probably a little clearer, showing the county cases going up in the orange, going up to the 772, and the line graph of the Yarmouth cases on the bottom. You can see that, you know, we're just one of the 15 towns, but ours is pretty well stayed, not going up on as a steep of slope that Yarmouth has just been kind of level going through. We've had a couple days where we've had 4 or 5 or 6 cases, but in general, it's been lower. And you can see it's been a steady graph, but we're still on the increase and really haven't plateaued or started to go down yet. And then I think it's that next one is the weekly one. Yeah, so that's the Yarmouth cases that are going up that we just showed earlier. That shows that we have 62 positive cases in Yarmouth starting on March 11th. And you can see that curve still going up, not to have leveled off. This is a Yarmouth positive cases, new positive cases by day since March 11th. There's a couple spots blank when we started off where the town did not receive any cases. And then you'll see a couple spaces throughout that are blank where we received no cases, but pretty much every day there was a number of cases. You can see a couple days we had 5 cases, a couple days at 4, and a couple days at 3. And then we have an average going on that. Hillary, would you like to talk a little bit more on this graph?
Yeah, perhaps what's unique about this is only the new positive cases where I put up a trailing, it's called a trailing day average, and I use 7 days here. So every 7 days, I create an average. You can see, for instance, after that March 11th, you don't see any red line there. And that's because you have to wait 7 days to get that first average, which is 7 days later, which is the 18th. And then you average the 18th to 25th. So every 7 days is a new average. And I think what's helpful about that is it avoids the daily fluctuation appearance on a graph. It's just another way to look at it. And just kind of smooth out the line a little bit as opposed to having spikes, which a bar can give you that way, or even a line graph can give you. So it's just smooths out, I think a little easier to look at. Basically, things are, are averaging out. It's a small window. You have to remember, if you look over at your y-axis, most of that red line is running between 1 and 3 cases per day. So it's a pretty narrow window that we're looking at. So that's what you're looking at.
Okay, thank you. I think.
I have a question.
Oh, yes.
I have a question, Mary Craig. Are you going to talk about contacts? Because I do have some questions about that number.
In reference to what?
Well, I just want to know what is happening with those contacts. I think the VNA is helping. I mean, are they actually being contacted by and interviewed?
Mary, I think Bruce is going to address that. It's an issue unto itself, and
Okay.
because a lot has been happening.
Okay.
It's been great. It's been kind of exciting.
Okay.
Working with
Yeah,
you.
I can answer that now while you kind of look at this graph. Yes, the VNA is checking the contacts. So when we get don't put it up there. When we get a positive case, the VNA will call that person. We get the positive case by being notified through the state testing labs, through the state MAVEN program. So we'll get a notification along with the VNA at the same time that we have a positive case in town. The VNA will log on and call that person and then ask the person who else is in the house as possible contacts. So VNA, the first case, so they talk to the person, tell them they're positive, they have to go into their isolation period of 14 days. They ask them who else is in the house, what type of contacts they have had with the person in isolation that's positive, and whether they need to go into quarantine also. So they're being followed by the VNA also. So the VNA is following the positive person in isolation, and they're also following any contacts that person may have in the house or possibly in the work environment. And then they follow them during the week also for a period of 14 days before they're released from their quarantine.
Bruce is
So
also.
do they,
Go ahead, Mary.
do they also ask about if that person has been outside of the house and perhaps not at work, but shopping or doing some other kind of activity outside the house where they might have come in contact with someone?
I'm not sure how far the detailed question goes. I mean, obviously, if they just went to the store or to the pharmacy to pick up something, they were probably not in
Right.
contact with somebody less than 6 feet for 15 minutes. I think
Right.
that's what they ask them is, have you been in contact with other people within 6 feet for less than 15 minutes? And I think they narrow it down on that way.
It's unfortunate in that there's a delay in the time the test is taken and when the results come back. So it could be easily a 3-day period of time where that person may have been out there.
Is this like a?
And so the next, when the nurse calls, is that sometimes the first time the person has heard that they were positive?
Correct.
Yes.
It is.
Yes,
Wow.
a lot of times we're the first time that they hear from us. Sometimes the doctor will
Uh-huh.
call them right away also, but
Right.
many times we're the first contact back to that person.
So the nurse has probably a lot of questions from that person at that point.
Right, there's a standard DPH list of questions that they need to ask each person and each contact.
No, I mean the person, the victim itself, has questions at that point, I'm sure.
Oh, yes, and then they explain,
Yeah.
yes, the VNA will explain and discuss with them what needs to be done under isolation or quarantine.
Right.
It's also important to keep in mind that we're making the assumption that a person's going to answer the phone, or in fact, that they're home. So the
Right.
VNA often has to make several attempts, whether it's on the phone, emailing, through regular mail. So we've had cases where there have been several attempts to try to find the person and inform them of the positive test result.
So how many contacts have not been contacted?
I don't have that statistic.
We have,
Okay.
we have one out of the many that we've touched base with, and what we did is we sent out, the VNA would try several times, and they send out a letter.
Okay.
And the letter has not been returned. We have it's a recent one that the letter was probably sent out last week, has not been returned. So we're still trying to reach that person.
Okay. Great.
Bruce, maybe you can mention the contact tracing collaborative, which is going to be helpful. This is a system in addition to what the VNA has been doing with the Maven system.
Yes, the VNA is really doing the same thing as the contact tracing program that the state's doing. They have a couple of those people working with the VNA. What that means is they're just doing as frequent follow-up calls to each of the contacts to make sure that they understand staying in quarantine. Did they have any other quarantines? Did they think of any other contacts that they might have been in touch with? So the VNA has been doing that right along from the start.
Bruce, is the VNA working with all the Cape Towns doing that? Are all the Cape Towns doing contact tracing?
Yes, they are. Not all the towns use the VNA.
Right.
Sandwich has their own town nurse. Barnstable has their own town nurse. But besides that, the VNA is doing the work for all the towns and doing the contact tracing.
They've been very responsive. I can tell you when I text, I get an answer in minutes right back. So the VNA has been doing a great job.
Yes, they have.
Good.
And we've stayed in touch with them. It's almost 24/7. I mean, if we get something that comes in now or 8 o'clock at night, we can text them and they'll get back and give us an update. And they're with us also if we need them on the weekend also. We stay in touch with them during the weekend.
That shit.
Lately, some of the research that we've been doing when a case comes in, a positive case, Phil's been looking at it, and a lot of times we've been looking at the address because a couple times we've found that the address might have had a Yarmouth address, but yet the people were not living in Yarmouth. We have 2 people in quarantine in Naples, Florida, that had used their Yarmouth address, and that didn't get passed over to Florida, so we're still monitoring that one, and have been in touch with them before they head back to Yarmouth. We've had 2 or 3 that have come in the last week that the people have been in nursing homes for the last couple of weeks in other towns, so they would
Right.
not have come up with a case from being in Yarmouth. So those cases have been transferred to other towns, and we've been in discussion either with the VNA or the town nurse in those towns.
So those cases are attributed to the town in which the nursing home is where they reside.
That is correct.
Okay.
That is correct. Because that's where the person was. I mean, we had one that was in a
Right.
nursing home for over a month, and we just got the case now, so it wouldn't have started in Yarmouth at all.
Right. Thank you.
Okay. Any other general questions before I move on to a review by town?
One point is Phil is doing a great job in informing our first responders of the new positive cases and their addresses, not their names, of course, but addresses, and keeping them up to date who's still in quarantine. So,
Yes.
great job.
Every morning, Phil checks the state listing of any new potential positive cases, looks at that, and send out an update to both first responders, police, and fire of any new addresses of positive cases. And that goes out at 9 o'clock pretty much every morning. And if something comes up during the day, Phil will update that. And then at the end of the day, Phil will give that back to police and fire with any update on it also of the address. And then at the very end of the day, the board receives their update of what the number of cases is for the day, along with the town administrator.
Right. Good work. Thanks, Bill.
Okay. Yeah, he's done a great job tracking things down. It's been very, very helpful. Okay. The state just started releasing town-by-town data 2 weeks ago. Up until then, it was up to the towns to put on their own website. Some towns did, some towns didn't. So what they finally, the state found and said they were going to post it, which was, I think, very helpful for the towns and trying to take public health action in education. So what I did is put a little 2 charts together. The one on the left-hand side, you can see as of April 14th, the number of positive cases in each town. And then what the state has is they base it on a rate of 100,000, population of 100,000, based on their current census. And I think that census went back to 2007. And that's a standardized rate, so they can figure out how it goes across the Commonwealth. What I tried to do is break it out for our 15 towns on the Cape, and you can kind of see where the positives are. And you can see that we had a lot of positive, but based on our population, our average rate was 174. Provincetown, with a smaller population, had a very high rate of 686. And then you can see Falmouth with 96 cases, what their rate was, and Barnstable with 94 cases. I think at this period of time in the early April, what I'd say is April, the coronavirus is still migrating its way down Cape a little bit. I think we've seen it migrate from New York to Connecticut, Rhode Island to Boston, and now it's working its way down to the Cape. And I think you'll see some increased cases down Cape as we go forward. So I think if you looked at how that sat, you can see Yarmouth sitting at 42 with a rate of 174. We had the 6th lowest rate on the Cape. So obviously some of the proactive measures the Board of Health took in early April, and whether that was, getting ahead and taking proactive measures, I mentioned, on closing, the libraries, the senior center, rec areas, in areas in town, and getting education out. I know the beaches have always been a discussion from mass gatherings. We saw at a couple of the beaches. But I think of all the actions the Board of Health taking, you can see that we're one of the 6 lowest towns, and I relay some of that to the actions that the board has taken. If you look at the next Wednesday, when the Department of Public Health came out with their town-by-town state, we looked at some of the numbers that were increasing. The questions under Provincetown and Brewster, I don't think they were quite updated by the Department of Public Health, because they still had Brewster at 18, Provincetown at 18 and Brewster at 64. And we know from reading the paper, Brewster had 60 in their one nursing home, and then they had about 72 in the town. So we know that needs to be adjusted. But we can see Bourne jumped up to 99 cases. We can see Barnstable jumped up from 94 to 133. So you can see the number of cases increasing from April 14th to the following week of Wednesday, April 22nd. Yarmouth cases increased 10 to 52 with our overall rate of 216. But then you also saw a couple other towns increase. So as the towns increased down Cape, Yarmouth was now the 5th lowest rate Cape-wide. So again, I think that contributes to some of the early actions the Board of Health has taken, getting the education out to the public listening to the concerns the Board of Health has had, and listening to the governor's advisory, the stay-home advisory. Hopefully more people are listening to that now. We also see more masks being worn out in the public in the last week when you go out shopping. That was something that was recommended by CDC and the governor early, but it took probably about a week and a half ago to see most everybody starting to wear a mask now, which I think is very positive. So I think looking at statistics, whether it's the bar graph of the towns going up and the rates still increasing on the county and with Yarmouth, the early actions that have been taken within Yarmouth, I think it's showing that the preventive measures have helped at this time. Any questions on this chart right here? Okay. I just think it's a significant chart that we'll keep updated as we move forward, because I think that's important to see how things are going. I am also in regular contact with our nursing homes that we have in town and our long-term independent living facilities on a weekly basis of if they have any cases. They're all been taken since into March. No visitors have been allowed in any of these facilities. They've been posted. They're all checking all staff when they come in. They're all checking temperatures of staff coming in now. They're also checking residents' temperatures in the nursing homes. So they're doing a lot of proactive at this time. Same with the independent living facilities, are doing the best that they can to stress the education to the public and the need to have limited interaction with other people.
Bruce?
Go ahead.
So we have not had any clusters in nursing homes or assisted living in Yarmouth, correct?
We have had a couple cases of 1 or 2. We're looking at that as that could be a beginning of a cluster. We're not sure. We are talking to the one nursing home now, and we might be doing some additional testing to try to stay proactive in front of the nursing home. So As of now, we do not have any large cases like we've seen in a couple of the other towns' nursing homes. You're correct, but we're trying to stay out of it and be proactive with a couple of the nursing homes right now.
Okay, thank you.
Bruce, are we testing like whole nursing homes, or are we just testing how is that whole thing working?
We have two nursing homes in town. One had done about a week and a half ago where they had a positive case and a positive worker. They went and obtained test kits through the National Guard and started testing everybody in their nursing home. At first, the test kits came out, it was just for people that either had symptoms, but since then DPH has changed that you can test more people. So
Right.
they've gone through more testing within the nursing home over there. The second nursing home that we're working with now has a positive resident and a positive worker. So they're working at either obtaining test kits or working with the National Guard to increase testing of those residents and workers.
And has that been challenging, or are you able to get the tests that you need?
Right now, we've been able to get the tests that we need from working with the Department of Public Health and working through the National Guard. So right now, and coordinating with the nursing homes that take the lead point in this.
Thank you.
From what I read, the tests that have been sent out by the Department of Public Health, the last I read, they sent out like 14,000 to nursing homes, and only 4,000 came back, and many of them were not correctly sampled, broken tubes, etc. So I hope that the testing that's done in our nursing homes is done by the National Guard.
Last week, actually, the governor suspended it for a short period of time because of what occurred.
Is that right? Okay.
I believe it's back on, and we're expecting National Guard in perhaps 2 days to go to one of those facilities here.
Good.
So that's the update on the coronavirus. We've had some robocalls the last couple Fridays to try to keep the public updated. This was a good opportunity for the Board of Health to reach out to the public also, so they could hear what's going on as some other items later on the agenda that are important to discuss. So with that, Mr. Chairman, we can move on to the community mask program.
Okay. Director Murphy.
Bruce, could I ask a question?
Sure.
Sure, Charlie.
Yeah, out of these 62 right at the moment that test positive, we have in the town right now, I was told, we have 44 recovery. Is there anything out of that recovery, out of those 62, or is it separate?
No, that's a great question.
I mean, we got to start recovering from this sometime,
Right,
and I haven't heard a thing from anybody about recovery.
Right. No, they do recover. I mean, obviously, we've had 62 since March 11th. As people drop off after they go through their 14-day quarantine or have been in isolation, have been sick, and have finished their quarantine and have come back, they get dropped off the overall list. So right now,
Okay.
I don't have the exact number, Mr. Holloway, but we're following about 40 that have recovered. That had the
I was told 44 today.
That could be. I don't have the number right in front of me right now, but that could be the number, correct.
There are 2 people who did not recover. We've lost 2 people. There have been 2 deaths.
Right.
Okay. Bruce, want to tell us what's up with the community face covering or mask program that we kind of kicked off about 10 days ago?
Yes, it's a program that the Board of Health had been discussing probably for over a week now, or a couple weeks, about trying to get more masks out to the public. And what the program came up was a goal to encourage people in the community, because we had some people asking, how could they help out the Board of Health? How could they help out within the community in any way they could? And one thing we came up with is, why don't we come up with a community mask program that masks are hard to find, and maybe people at home can start making masks. And the mask would be eligible first. The first group would be for people in isolation or quarantine that might need a mask for other family members. So what we did is we're thinking is people at home that wanted to participate in this program, which we still have open and encourage people, is they could make a mask, and we were in partnership with the senior center, who's been terrific up there. And we said, well, why don't we work through the senior center, this program? And what people would do is we could coordinate making the mask, drop them off at the senior center, and then people could go there and pick them up. So Diane, the director at the senior center, was more than welcome to help coordinate that. And like I said, the first would be for families of people in isolation and quarantine. And then after that, would make the mask available to elderly people that either have a medical condition or a healthcare worker, or the elderly first, before we would open it up to other people in the general public. The people would call, we've sent this up out through the senior citizens website, and their call it has gone out. VNA nurses mention it to people when they talk to them, whether it's a nice person going to isolation or contact, that this program's available. We've reached out in the community, and it's been a great response from a number of people around the community making masks, and it's worked out very well. Some of the people had material, but we also went out and bought material, cloth material, that we could provide people if they need it. And the most difficult part when we first started was the elastic for the ear loops. And we were able to get a terrific donation from 200 feet from a sailmaker in town that had some extra sailmaking elastic that he needed, that he would donate towards the program. So we've added that to the program. So that's worked out terrific. They make the masks, they drop them off at the senior center. Senior center puts them in a bin, lets them separate for 2 days, 3 days before they recycle out into a Ziploc bag as needed. When the people call, the seniors will bring it outside when they drive in and give it to them. We've asked the seniors, when they do come up to pick up a mask, if they could bring one canned good, and we would put that towards the senior center food pantry. So it's going very good, and I do need to give out some credit to Hannah that's helping us do this, and I don't know if you want to talk a little bit more, Mr. Chairman, of how this has been going.
It's a mass production, but it turned out to be. Initially, we're talking about, let's see if we get 30 masks produced, and we have a few hundred that have been done already. So
How many?
We have about 300.
I hear you.
We have about 300 that have been made already.
Excellent.
So we're going to probably keep publicizing it more. I mean, we're just started it last week, so we're trying to ease into it. But I think we're going to be getting it out more on this information here. We'll get it out on a robocall into the week also. We'll put it up on our town website, and the seniors are also getting that information out to people.
Bruce, can I ask a quick question about it?
Sure.
So you're saying that ideally we'll start with people, families of people in isolation and seniors, right?
Correct.
And at which point would it be open to more like people like myself? Not that I need one, but I'm just saying, like, residents of
That's a
like,
great
so if I
question.
know people who need them that maybe don't fit in that category, can I share this information, or should we hold off on that?
Sure. No, we're trying to ask people that can make masks, if they have the skill set, so to say, to make a mask. If they could make a mask for themselves, a friend, or a neighbor, we encourage that strongly, and just not have everybody rely on this mask program, because we wouldn't have enough masks for
Sure.
18,000 people. So we're trying to
Yeah.
limit it to begin with. But
Okay.
as you know, people that might need them, they're all going to be welcome. We're just trying to limit them at the
Okay.
beginning right now. But people are welcome to call in, and if they can't make a mask or have somebody that can make one for them, they'd be welcome to get one.
Terrific, thank you.
They're following different instructions. We've had CDC instructions, Department of Public Health instructions, and what we've found is a lot of the mask makers that are really making 20, 30, 40, 50 masks have their kind of their own routine of how to make a mask, and they're all been very helpful.
Great, thank you.
Mr. Chairman?
Yeah, if you've done this, may be a good transition. We're talking about masks, and let's transition here over to the fourth item on the agenda, which is proposed regulation for face covering. And this is a regulation that we're going to discuss and vote on tonight, and it's really about mandating masks to be worn by employees inside essential businesses. Director Murphy, just give us a little background on how this came to be and why it was in our packet for tonight's meeting.
Sure. We've had a couple complaints on businesses not having face masks with their employees, whether it's just in a grocery store or a retail store. We've had several complaints. We're seeing other towns off Cape and on Cape and Sandwich have adopted this a week ago as just another proactive measure. And this would just be for inside employees that would have to wear a mask. I think it's reasonable. I think in the last, like I mentioned earlier, week and a half, we're seeing more people wear masks. So I think it's just something that we need to require because we still have some businesses out there not in compliance. Even though we've asked a couple, they're kind of slow coming around. So I think this would be important. The one edit that I would make in the regulation before you under one, section 1, where it says all employees, it should say all inside employees. You know, at this time, we're not saying everybody needs to wear a mask out in the public. This is directed for inside employees of essential businesses.
Bruce, when you say inside employees, do you mean employees that are front-facing customers? Like, how about if there's an employee that works inside that specifically works alone in a stockroom, or?
If they have are going to be any time within a six feet operating distance of somebody,
Anyone, right?
they need to have a mask. But this is really saying all inside employees. So you could be in a restaurant in the kitchen area where they're close together. All the kitchen staff would need to have mask on. If you're in an office building, such as Town Hall, if you're in your own office, you would not need one. But if you went outside your office or had somebody come in, you would have to put one on. If you're in the back side of a warehouse, you're the only person in there, you would not need one. But we're trying to encourage everybody inside to be wearing a mask.
Sure, I don't disagree with that. I'm sure we'll discuss it more. But I work in an essential business in a store with people, and so I have a few things just to comment on when we get to that part.
And we're really calling this, it's a face mask regulation because everybody understands the word face mask, but it's really face covering.
Face covering, okay.
Because we're not requiring somebody to get a mask like an N95 mask or a surgical mask. They need to be left, those type of masks need to be left for our first responders.
Sure.
This is really a cloth mask that can be made through and used as a facial covering, can be made. It could also be a bandana or a scarf or something that would be needed to be worn. And then it will also, the regulation require that all stores, central stores put on their door out front that all customers entering these establishments are recommended to wear a face covering over their mouth and nose in accordance with CDC guidance. So we're not requiring people come into the store, but we're highly recommending everybody to enter to wear a mask.
Mr. Murphy,
Yes.
I have a comment about masks.
Sure.
Okay, N95 masks are only protecting the wearer. They're not protecting other people. So people shouldn't be even thinking about wearing an N95 mask, because when we put our masks on as citizens, We are protecting others from us only. So it's a courtesy to the others around us that we're not breathing any germs on them.
Just to make a point, I know you're in the car, just to let you know that there is actually a sentence here addressing the issue of the N95s. Perhaps because it's a virtual meeting, the order could be read, I suppose. Mr. Murphy, you agree with that?
Yes, I
Maybe
don't
a
know if
good
we have
idea.
a member that might want to read it through.
Well, we have a go-to person who's probably the most articulate one on the board, Deborah.
Deborah would need to pull that up first. Deborah doesn't have that on her screen at the
Does
moment.
not. Okay. Do not. It's on my screen. I can read it if not. I'm looking at it on the screen. You don't see it?
Oh, now I see it. I'm sorry. Yes, I minimized everything, but now I can see it. I just have to pull us off to the side so I can read it.
You can vote no if you want on you reading it.
No, I vote yes. I'm happy to read it.
Thank you.
Okay. Now that I can see it. All right. Let me
Just include, just one point, just include inside under item number 1 where it says all employees, it should be.
inside. I got you.
Yes, thank you.
Okay, starting at the top. Pursuant to the declaration of a public health emergency on March 17th, 2020, 310 CMR 11.05, 105 CMR 300.200, and all other authorizing statutes and regulations acting by and through its agent authorized under MGL C 111, I don't know what that symbol means, 31. We, the Director of Public Health for the Board of Health of the Town of Yarmouth, Massachusetts, hereby order the following. All employees inside of all essential businesses shall wear a face covering over their mouth and nose when interacting with the public and within 6 feet of a coworker. The cloth face coverings recommended are not surgical masks or N95 respirators, which should be left for medical professionals and first responders. And then there's a link that says that it explains how to make a cloth face covering. Number 2, all essential businesses shall post on their main entrance doors that it is highly recommended that the consumer entering the store wear a face covering. Essential retail establishments, as defined by Governor Baker's COVID-19 executive orders, must limit the number of customers and staff inside the establishment at any given time so that social distancing of 6 feet may be maintained. All retail establishments must establish maximum occupancy loads in accordance with the guidance for grocery stores issued by the Massachusetts Commissioner of Public Health on April 7th, 2020. And then there's a link that you can read the order. You can just click on it. Maximum occupancy shall be posted at each entrance to the establishment and shall be readily visible to members of the public. An employee of the retailer shall be designated to ensure the maximum number of individuals inside of the store is not exceeded. Customers queued outside of the store must maintain a minimum of 6 feet distance. Any portions of the store requiring extra staffing solely dedicated to services that are deemed non-essential pursuant to Governor Baker's COVID-19 executive orders shall be closed. Reusable shopping bags are prohibited, single-use bags are permitted, and shall be provided at no extra cost to customers.
Thank you.
And then there's...
Yeah, why don't you read the last part, just
Sure.
Thanks.
Yep. The emergency order shall be effective beginning, I would imagine if we vote on it, it would be tonight, the 27th. April 27, 2020 at 12:01 a.m.
So let's make it the 28th.
28th, sorry, yep.
Yeah.
April 28, 2020 at 12:01 a.m. and remain in effect until notice is given pursuant to the Board of Health's judgment that the public health emergency no longer exists. To the extent necessary, this order shall be enforced by the Board of Health and or its agents. Ordered, and then if we vote yes.
Thank you, Deborah.
You're welcome. No pressure.
Mary, was your question answered about the N95?
Yes, thank you. Do you you want a motion?
I'll always like motions. You're on, Mary.
I move that we approve the motion as regarding the order by the Board of Health, read by Deborah, effective April 28th, 12:01 a.m.
Is there a second to the motion?
Second.
Okay, so how about some discussion, folks? What's on your mind?
I guess.
All right, I got a little.
Oh,
never
go
mind.
ahead, Charles. Go ahead, Chuck.
Who's enforcing all of this while it's going on?
Good question. It not going to be.
The health department.
Yeah.
Yes, the health department would be enforcing it, would be getting it out to the businesses. We have a lot of them on email, so they'll all be getting an email tomorrow.
Yeah, I understand that, Bruce, but who's going to enforce it? I mean, you know, if somebody goes into the stores not wearing a mask, who's going to arrest them?
It's not the people going in the store.
Not the people going in.
Okay, well, how about somebody working in the store that's not wearing a mask? So who's going to arrest them?
Well, I think we would talk to them first, explain the regulation to them. From what we're finding in other towns, once it's brought to people's attention and the safety and the reason doing it, people have come into compliance.
There's no penalty associated with the order.
Correct.
So
And I
just,
think it's going to rely on the public calling and saying, you know, this is the second time I've been in there and they're still not masking.
So then what, the Board of Health going to close down the store or what?
No, Bruce said that the health department person would go in and talk to them and make sure they understood the order, that they had heard about it.
Correct, I understand that, but if it continues,
Well, if it continued, they'd get a violation letter. They might have to appear before the Board of Health. And indirectly, there could be a fine. Mass General Law 111, Section 31 does, that this is being adopted under, does have penalties, but I don't see that happening. I see the spirit of cooperation working with our businesses. I think that would come first.
well, what I see right now going in and out of stores personally is I see a lot of cooperation already. You know, I haven't seen maybe a handful in the last week that weren't wearing a mask.
That's great.
So I'm trying to understand why this is going on.
so if I can just speak to this for a moment, only because I'm in a store 10 hours a day with the public in a store. And my experience since this has happened is that the employees want to wear masks for the most part.
Correct.
If you're working a 6, an 8, or a 10-hour shift, having a mask on for 8 or 10 hours can be a lot. And the reason why I brought up if they have to wear one, if they're working in remote areas of a building, and I'm speaking like big volume stores. I'm not talking about a convenience store or a Stop and Shop or something like that. If there's someone stocking over in dairy and there's no one there, can that person take their mask off while they're stocking? And there's no one around them, but then if a customer approaches or something, that if they're within 6 feet, they should put the mask on. What I'm seeing in my situation, and I'm a store manager, so I manage a building with employees, is that the issue is really the people coming in. And I've had to actually break up discussions, let's call them, between customers wearing a mask and not wearing a mask. The issue hasn't necessarily been staff not wearing a mask. It's customers sort of jarring at each other about not wearing a mask. So I can only speak to sort of what I see every day on an ongoing basis. You know, I wear a mask when I'm front-facing customers, when I'm within 6 feet of anybody. But I work 10 hours a day. And if I'm not wearing a mask in a remote area of the store and someone sees me, and I don't work in Yarmouth, but I'm just saying, like, they shouldn't be calling the Board of Health and say, hey, I saw somebody working in the store with no mask. And I guess my concern is something like that could happen. I see it more important that customers who go into a store for a short period of time and really should be wearing masks, whereas employees and all the front-facing ones that work for me and that I've seen personally in every store I've been in are wearing them. So that's kind of my 2 cents.
You know, Charlie, part of this order is the recommendation of a person entering a store. There'll be a sign on encouraging people to put on a mask. That's, you know, we're not going to be enforcing anything. It's really trying to encourage people to put them on and use them. Hopefully, fewer people will be walking into stores without masks. That's the goal of that. And that's essentially part of this whole order. It had to do with the sign that would be on the front door.
I understand.
Charlie, does that answer the question or not?
No, basically, but I still, as far as I've seen in stores, everybody's cooperating. Every once in a while, somebody will come in without a mask, but haven't seen any huge problems.
Then we're doing a good job. I mean, hopefully, as we're handing out more masks, people will put them on. I mean, ultimately, that's the goal. We all know that.
I have one more question about the order. There's a piece in there that there has to be recommended capacities. Is that will that be for all stores, convenience stores? I know Stop and Shop has it. I know the store I work at has it. Is that every store, or is that of a certain square footage?
It's grocery stores.
It's only grocery stores.
Grocery stores. That's the Department of Public Health recommendation, grocery stores.
Okay.
I see other stores practicing the same thing, like Ocean State
Right.
Job Lot, you know, Home Depot. They're all practicing that.
The post office.
Yeah.
Yep.
Everywhere I've been, it's been in the last 10 days. I've seen monitors on how many in and how many out, and which direction they're going in.
At least we're not Somerville, who just passed an ordinance saying that everybody has to wear a mask when outside.
I think that might cause a bigger problem than we've got now.
Well, we're not doing that.
Any other discussion? Why don't we go ahead and vote? Since this is a virtual meeting, perhaps we can do it by just take one at a turn. We'll know, so the people who are listening will know how people are voting. Charlie.
There's no second yet, Hillard. No one seconded it.
Then let's not vote on it.
Right.
I thought Eric seconded.
I did.
Like the-
Oh, he did. Okay, sorry, Eric. I didn't hear you.
No worries.
Okay, well, let's go ahead then. Mary, since we have you on there, are you voting for or against?
4.
Eric?
Aye.
Charlie?
Against.
Deborah?
Aye.
And I'll vote in favor as well. So, okay, the motion passes then. Director Murphy, are we okay with that? Is that completed?
Yes, we are.
Okay. Okay, that's 1 through 4. Anything else?
Just a couple general things under the business. We've had some inquiries and complaints about a couple areas in town that have been closed in the past. A couple of the recreation areas, whether it was on Sandy Pond in the dog park that was probably closed 3 weeks ago. Old Town House Road basketball area where we have seen gatherings of cars. We finally had to close that gate. And last weekend, we closed into Bayberry Golf Course, the gate there, because we saw golfers parking and going on. We're looking at opening that up and just posting a sign there so people can keep the golfers off. They know the course is not open. The flags and flag sticks have been removed, but people were going in there to walk on the trails and bike the trails, which we're trying to work with that to work that out. So, we need to fall back that, the governor does have a stay-at-home order. I think that's the first thing we need to pay attention on, is encouraging and educating people. It's still a stay-at-home order by the governor. And we also received another complaint about Gray's Beach. Even though the boardwalk has been blocked off, people are still climbing around and going out on the boardwalk and gathering on the beach. So we're going to look at that area and try to see if we can do some other further posting on that area also. But I think we need to look back on the stay-at-home order and education the public and what actions the Board of Health that have taken that will prevent the keeping the public healthy is, I think, our number one goal. And I think we've seen that we've been doing a good job right now on the number of cases based on Barnstable County and what's going forward. I think the other new thing that we probably saw come out over the last 2 weeks is Cape Cod Hospital Healthcare has come out with a heat map where you can look at each town by zip code and find out what the number of cases are in your zip code area. And I think that's very important to look at. When you do look at that, they've broken up the Cape into 3 areas: Upper Cape, Mid Cape, and Lower Cape. And they have a different color. If it's red, it's kind of a high in the case numbers. And I think when you looked at that, out of the Upper Cape and the Mid Cape, Yarmouth had the least number of cases per 100,000. So Yarmouth had the best number in response to cases per 100,000 for those areas, Upper Cape and Mid Cape. So that's an area we're still looking at. Some of the heat map zip codes are off a little bit. So I've talked to Cape Cod Healthcare on that and the county on that, just to try to clarify that. But that's another area, if people at home want to look at something, is go to the Barnstable County Health Department website, and it's posted there along with the Cape Cod Commission website.
A couple other points. One, heard from Chief Frederickson just that there have been numerous domestic violence cases, and that unfortunately is probably expected where people are in homes together for long periods of time. So Board of Health is aware of that. The other is the long-term facilities. It's a place where the infection could spread very rapidly, and it's a very vulnerable population. Keep that in mind. So things could change drastically and very quickly. Another point is what to expect. What's coming is the population on the Cape is going to be growing rather quickly. Weather's getting warmer, and the issues of mass gatherings that we're going to have to address as a board. And that's what's coming. It's kind of unique in Massachusetts, this particular area, the Cape. The last point I just want to make is, sure, if you're watching the news, there's a lot of debate just about loosening of restrictions. We've seen that in other countries. We're seeing it here nationally, towns, cities, and that will be an issue here like it is every place else, just to keep that in mind. It will be coming along in one of the next meetings, I'm sure. Anyone else? Before we close.
Just that, yes, I just wanted to comment that even though May 4th is the date that we are supposedly ending the stay-at-home, that probably isn't going to happen from what certainly not from what the mayor of Boston said about Boston, but from what the governor said too, that the peak has not been in early April as was anticipated, but is end of April still going on. So I think we can expect that we will see a continuation of the stay-at-home orders.
I agree. As I said, the population is going to be growing, and a lot of our visitors, by the license plates, they're often coming from, high density areas with high rates of infection. New Jersey and New York and so on. So our timetable could be quite different.
Right.
And I think the governor's closed daycare maybe through July. It's certainly extended beyond the school year. So
Through the end of June.
end of June. Yeah. Okay.
Yeah. Yep.
All right. Anything else? Not someone can make their favorite motion.
I move we adjourn.
Your second?
Second.
Is there none? All in favor, say aye.
Yep.
Aye.
All right.
Aye.
All right. Good evening. Thank you, everyone.
Thank you.
Stay healthy.